Childbirth. Onset of labor. Childbirth typically occurs within a week of a woman's due date, unless the woman is pregnant with more than one fetus, which usually causes her to go into labor early. As a pregnancy progresses into its final weeks, several physiological changes occur in response to hormones that trigger labor. A common sign that labor is beginning is the so-called bloody show. During pregnancy, a plug of mucus accumulates in the cervical canal, blocking the entrance to the uterus. Approximately 1 to 2 days prior to the onset of true labor, this plug loosens and is expelled, along with a small amount of blood. As labor nears, the mother's pituitary gland produces oxytocin. This begins to stimulate stronger, more painful uterine contractions, which, in a positive feedback loop, stimulate the secretion of prostaglandins from fetal membranes. Like oxytocin, prostaglandins also enhance uterine contractile strength. The fetal pituitary gland also secretes oxytocin, which increases prostaglandins even further. And the stretching of the cervix by a full-term fetus in the head-down position is regarded as a stimulant to uterine contractions. Combined, these stimulate true labor. Stages of birth for vaginal delivery. The first stage. Uterine contractions signify that the first stage of labor has begun. These contractions may initially last about 30 seconds and be spaced 15 to 20 minutes apart. These increase in duration and frequency to more than a minute in length and about 3 to 4 minutes apart. Typically, doctors advise that they be called when contractions are coming about every 5 minutes. Some women experience false labor or Braxton Hicks contractions, especially with the first child. These may come and go. They tend to diminish when the mother begins walking around. Real labor pains tend to increase with walking. In 1 out of 8 pregnancies, the amniotic sac, or water in which the fetus is suspended, may break before labor begins. In such cases, the physician may induce labor with the use of medication if it does not begin on its own in order to reduce the risk of infection. Normally, this sac does not rupture until the later stages of labor. The first stage of labor is typically the longest. During this stage, the cervix, or opening to the uterus, dilates to 10 centimeters, or just under 4 inches. This may take around 12 to 16 hours for first children, or about 6 to 9 hours for women who have previously given birth. Labor may also begin with a discharge of blood or amniotic fluid. Stages of birth for vaginal delivery. The second stage. The passage of the baby through the birth canal is the second stage of labor. This stage takes about 10 to 40 minutes. Contractions usually come about every 2 to 3 minutes. The mother pushes and relaxes, as directed by the medical staff. Normally, the head is delivered first. The baby is then rotated so that one shoulder can come through, and then the other shoulder. The rest of the baby quickly passes through. At this stage, an episiotomy, or incision made in the tissue between the vaginal opening and anus, may be performed to avoid tearing the tissue of the back of the vaginal opening. The baby's mouth and nose are suctioned out. The umbilical cord is clamped and cut. Stages of birth for vaginal delivery. The third stage. The third and final stage of labor is relatively painless. During this stage, the placenta, or afterbirth, is delivered. This is typically within 20 minutes after delivery. If an episiotomy was performed, it is stitched up during this stage. Additional considerations. More than 50% of women giving birth at hospitals use an epidural anesthesia during delivery. An epidural block is a regional analgesic that can be used during labor and alleviates most pain in the lower body without slowing labor. The epidural block can be used throughout labor and has little to no effect on the baby. Medication is injected into a small space outside the spinal cord in the lower back. It takes 10 to 20 minutes for the medication to take effect. An epidural block with stronger medications, such as anesthetics, can be used shortly before a cesarean section or if a vaginal birth requires the use of forceps or vacuum extraction. Women giving birth can also receive other pain medications, although medications given through injection can have negative side effects on the baby. In emergency situations, such as the need for a C-section, women may be given general anesthesia. They can also choose not to utilize any pain medications. That is often referred to as natural childbirth. Women can also use alternate positions, including standing, squatting, being on hands and knees, and using a birthing stool, and laboring, and even delivering in tubs of warm water to help relieve the pain of childbirth.